Hey, welcome to Neurodegeneration and AI in the Gulf. I'm Sohith, and today we begin a critical conversation on the growing burden of neurodegenerative diseases and how artificial intelligence may help us tackle it. These diseases, which include Alzheimer's, Parkinson's, ALS, and Huntington's, aren't just devastating for individuals and families. They are fast becoming one of the most pressing global health crises. Alzheimer's, for instance, currently affects more than 55 million people worldwide, and this figure is expected to triple by 2050. Parkinson's, on the other hand, once seen as relatively rare, is now the fastest growing neurodegenerative disorder globally. But the urgency of this crisis isn't only in the numbers, it's in how ill prepared our healthcare systems are to manage the explosion in cases. One of the biggest challenges is the assumption that memory loss and cognitive decline are simply part of aging. This misconception often delays diagnosis and treatment. In reality, by the time noticeable symptoms appear, more than 70% of neurons may already be damaged. That's a staggering loss and a huge missed opportunity for intervention.
Beyond aging, environmental and genetic factors are fueling the rise. Exposure to air pollution, heavy metals, pesticides, and even certain industrial chemicals has been linked to increased neurodegenerative risk. Regions like the Gulf, where rapid industrialization has occurred, are particularly vulnerable. Yet, data from countries such as Qatar, Saudi Arabia, Oman, and the UAE remains limited. In many cases, neurodegenerative diseases in the Gulf go undiagnosed or underreported. Culture norms, such as families preferring to care for elderly relatives at home, and the absence of widespread cognitive screening, contribute to the problem. This makes early detection even harder and burdens caregivers who often lack clinical support. Another challenge is the shortage of trained specialists, neurologists, geriatricians, and memory care professionals. Many Gulf nations rely heavily on expatriate medical staff, which creates additional challenges in offering long-term culturally attended care. While some urban centers boast cutting-edge hospital, rural areas still face major access gaps compared to their counterparts.
Here is where artificial intelligence enters the picture and potentially the solution. AI is already transforming how we approach early detection. For instance, machine learning models can now analyze brain scans, detect subtle changes in neural patterns, and even process biomarker data to flag early signs of neurodegeneration, even often before symptoms emerge. However, most of these AI tools have been trained on Western datasets, limiting their effectiveness in other populations. So, in order to make AI a true ally, we need diverse, region specific datasets. Only then can diagnostic tools provide accurate predictions for patients in regions like the Gulf, Africa, or South Asia. Even with advanced algorithms, access is a major issue. AI powered brain imaging, genomic sequencing, and fluid biomarker tests are expensive and not widely accessible in many parts of the world. Public health systems, especially in developing countries, need funding to integrate these tools into regular diagnostic pathways.
At this crisis, we need more than just machines. We need a multi-layer strategy. That means investing in public awareness, training primary care doctors to recognize early symptoms, and expanding memory clinics and home care programs. Governments must support AI based diagnostic platforms and ensure that they are ethically developed and accessible to all. Policymaking must also catch up. While nations like the UAE and Qatar are investing in smart hospitals and research hubs, rural and underserved communities still face massive care gaps. Moreover, we need to focus on epidemiological research in regions that currently lack data so we can track and understand disease trends better. The future of early detection lies in the convergence of AI, biomarker science, and accessible healthcare systems. But we can only realize that future if we build systems that include all communities, not just those with resources. In our next episode, we'll go deeper into the biology of neurodegeneration itself. What exactly happens in the brain when neurons begin to fail, and how is AI helping researchers map these changes down to the cellular level? Stay tuned.